children need a good foundation for entry into school. And it's a foundation in health, it's a foundation in language, it's a foundation in social and emotional well-being. And most importantly, it's a foundation in being a member of a family and a member of a community. So I love the term child development, but in many ways the term family development is a very important one. As our children come into the world, what they really need is a foundation within their families, within their communities. And I think that's what early childhood programming is all about. It's not exactly about opening a book and doing your maths when you're born, but what it's about is forming all of the foundation for being able to do that when you get into school. And I think that's hard for some people to recognize, is that when babies are born, their brains are forming, and everything that happens for them is preparing them for that entry into school. So the answer to your question is that children need preparation for entry to school in a loving environment in their family, in a strong, supportive community, and in an environment that honors children. So just following on what you just said, I think we have a big problem in the United States. I think we don't understand how fundamental early childhood is. I just saw some data that I actually hadn't seen before, showing the minuscule amount of money that the United States spends on our children compared to all of the other developed countries. We're spending just a minuscule amount on our children and an even tinier amount on our early childhood programs. So, to be honest, the answer is that I think we need much more attention at the federal, at the state, and at the local level to the investment in early childhood. I had the opportunity to work on the Brookline Early Education Project, which was one of the programs that brought the evidence forward that investing early, and we're talking 3 months before birth. That's pretty early, right? Was valuable and actually worked. I've had the opportunity to actually follow the young people that were in that program until they were 25 years of age. And that was a comprehensive program. BEEP was, and Early Head Start obviously is. And it's that comprehensive nature of recognizing that as young families are forming, they have many, many opportunities ahead of them for their children, and you want to support all of that. One of the sort of most fun parts about BEEP or about Early Head Start, or I'll talk a little bit later today about Chile, program in Chile, is having the joy of watching children's development, because there is nothing more exciting than seeing a baby be born and then seeing an 18-month-old being able to name all the objects in the room. What happened over that period of time? So bringing families into the secrets a little bit of what's going to happen next, what Barry Brazelton calls anticipatory guidance, or what I like to call readiness moments. And those are the times when, if parents know that the child is just about to start naming objects, they can be gently giving the names, giving the cues, giving all of that. And we know that if families don't have that information, if they don't understand that, they miss, unfortunately, those readiness moments, and that's a tragedy. So in terms of early Head Start, and when we talk about early Head Start, we're really talking about around the time of birth till around 3. That's enriching that understanding by parents of the wonderful unfolding of children's world. And it's not about all the toys and the equipment and all that kind of stuff. In fact, it has very little to do with that. It's much more about seeing how the child is looking at the world, how the child is taking in the information, and supporting the child's exploration of those things. It's essential. We're learning more and more and more about the human body over the last 10 to 15 years really, in terms of how our genes work, how our environment works, how one generation's experience actually gets fed into the next generation. Very, very complicated relationships between grandmother's body, mother's body, and baby's body. So it's very important, even in pregnancy and even before pregnancy, for women to understand that what happens in their body actually does predict, to some extent, not completely, but to some extent, what's going to happen in their babies. And absolutely, as we're setting down the patterns of nutrition for our infants, that's where those patterns really get formed. If we get used to certain sweetness in our tongue and our palate, we then want more of that. If we don't have a real sense of balance in how we eat our foods, we want more, and so forth. So early childhood is really the critical moment to just realize that food is an important part of our world, and that physical activity is an important part of our world, and to set the habits for our life that will, in fact, then prevent us from the obesity. And we've got some good news. There's news out of Massachusetts right now that we've turned around for the little babies, some of the obesity. So it can be done. So medical home is a term that means that the physician, nurse, the clinical care will be delivered in a way that is family-centered, that is comprehensive, that is continuous, and that honors the culture of the family. And what it really means is just the highest standards of good health care. But it also means that in the doctors' and nurses' work, they're thinking about health in a very broad sense. They're thinking about the physical health, the emotional health, the developmental health of the child. And so in a true medical home, that doctor and nurse has actually opened the door, gone outside, visited the healthcare, visited the child care center, knows where the schools are, knows where the parks are, and is really very much a part of the community. So that's what a medical home is. It's a term that embraces this idea of comprehensiveness, coordination, and family-centeredness,